gives me great pleasure to welcome you to today's noon meeting, which is being hosted by the Division of Environmental Health here in the School of Public Health. Most of you should know Professor Andrea Rutler, and I'm head of the Environmental Health Division. So it also gives me great pleasure to introduce our speaker for today. So Dr. Aminata Kilungo is a distinguished environmental health specialist, professor and global advocate committed to advancing health equity in marginalized community through research, education, and policy engagement. And she's joining us until November as a visiting professor. She's an associate professor at the Mel and Enid Zuckerman College of Public Health at the University of Cape Town. University of Cape Town, like rolled up. University of Arizona.
It's a good sign.
And is the founder of Health for Society, an organization focused on environmental health and climate resilience. Dr. Kilungo is also co-lead of the development of new One Health educational programs as part of the One Health faculty leadership team. I'm just going to very briefly talk about some of your experience, which was an advisor for over 8 years to the Federal National Advisory Committee to the US EPA. And she provided strategic guidance on the implementation of North American Agreement on Environmental Cooperation, strengthening environment and public health collaboration across the United States, Canada, and Mexico. She leads the Climate Change and Health Thematic Group within the Research Independent Non-Governmental Organizations RINGO constituency under the UN Framework Convention for Climate Change, helping shape global health policy responses to climate change. She holds a PhD in soil, water, and environmental science with a minor in microbiology. Her contributions have been recognized through numerous honors, including the Faculty Excellence in Teaching Award, and fellowships from the Alfred Sloan Foundation, National Action Council for Minorities. That's just a snapshot. So thank you very much for joining us today and for speaking to us about advancing climate health resilience through integrated research and community. Over to you.
Thank you very much for that warm welcome. I just want to take a few minutes before we start to thank the Division of Environmental Health for hosting me, and especially to Andrea, who has facilitated my stay and navigating. We've been talking about my coming here for quite some time, so I'm very, very excited to be here. And thanks for this opportunity to present and welcome everyone. Thanks for attending this lecture this afternoon, those who are here and those online. And I hope where I am standing, people can see me, right? The camera is right here.
I think you just see
online.
Yeah,
okay.
Where's the camera's there.
Okay. Excellent. So today I wanted to focus mostly on my work that has integrated a lot of the community engagement aspect. I come from a very quantitative training, but as I progressed in my career, I realized the issues that I was mostly passionate about actually really required me to be heavily involved with the communities at risk and had to really appreciate their knowledge, what they bring to the table in terms of coming up with solutions that are very much affecting them. So I will share some of my current works that we have done in communities in Arizona, along the border region where I work in Tanzania. So looking specific at my research, I really work at the intersection of climate change health with a heavy focus on water security, water access, water quality, and all for the aim to be able to work with communities themselves to build resilience. And building resilience really, in my perspective or my context, is to make sure they have the knowledge. They have the knowledge to protect themselves, but we also share the knowledge as scientists to make sure that they're well educated in issues that are affecting them, and building resilience to other issues such as water interventions, and that's primarily in sub-Saharan Africa or Africa, even though we do have wash issues in North America as well, and improving our ability to be able to monitor water quality in these at-risk communities to prevent diseases. So this kind of sums up everything I do, but I'm going to focus primarily for this talk on the work that I have done with communities. And we've been evolving, we have been learning more on how we work closely with these communities to be able to come up with interventions. So I want first to really give you a picture of the targeted communities, the more communities that I work with and why I define them as communities at risk. So along the Arizona-Sonora border, I hope you can see the mark over here. Now, those of you can see the red mark. So primarily, so Tucson, where I'm located, we're just about less than an hour to the Sonora border region to Mexico. And under the La Paz Agreement, how it defines the border, we are actually considered to be within the border region. But specifically, there are a lot of communities along the border itself that are marginalized, lack access to water and all the services that you would have in other parts of Arizona, for instance. And these communities, particularly the ones that I'm talking about closer to the border, they deal with a lot of environmental stressors, socioeconomic stressors, a lack of access to healthcare, high poverty rates, making them specifically vulnerable to climate change and climate change issues. The communities that I work with in Tanzania, I work with different communities in Dar es Salaam. Dar es Salaam is considered the bigger capital city, and more rural and up north ones. So if you would see the three circles here, these are primarily the communities I've worked with over the past 10 years. They have different issues, but very similar. Dar es Salaam is much more diverse. But also, there's a lot of inequities. When you move up to the rural communities, it's mostly agricultural, mining sectors, and so forth. So there is still increasing population, which is putting pressures on water resources, but may be seen a little bit different from the rest of them. But collectively, these communities, all of them, they lack water access. They lack access to clean water. There's a lot of population increase putting pressures on resources. And Tanzania, the past 10 years alone, has been experiencing a lot of, quite a few incidences of cholera outbreaks, but annually they've been having increased cases of diarrhea disease as well, all indicative of water quality issues. So the importance of community engagement, especially in my work, but in general, in really looking at solutions. Community engagement is important and very foundational to the way that we try to address equitable and sustainable and impactful solutions. So if we were to come in as scientists and impose our own knowledge and the solutions that we think need to be implemented to address some of the issues, because for the most part, we kind of have an idea what needs to be done, but we know that some of the solutions have actually failed. We have history when we look at improving water access from the MDG, the Millennium Development Goal, and now we're going to Sustainable Development Goals. We haven't always been successful. So really, in a sense, we need to start looking at the solutions, and the more impactful solutions really have to come from the communities itself to be implemented so that they're sustainable. Engaging communities also ensures that we're able to come up with solutions that are more culturally relevant. They are locally informed, but also really reflective of their lived realities, right? I've taken students, I used to run a water sanitation hygiene program, so Global Wash for Tanzania. And most students, when they just land, they're surprised why people cannot just wash their hands with soap, right? It seems like it's so simple. But until you understand the complexities and the priorities that everyday community members and the poverty and the other issues like just feeding their children and others that take over the priority over making sure that they have just soap to wash hands, or the fact that they have to, walk 4 or 5 times a day to just fetch water. It's the issues are much more complex than sometimes we think them to be. So in vulnerable regions that I've worked with, for instance, the Arizona Sonora region, or in the Tanzanian communities across the country, is that really indigenous or local knowledge that you can kind of harvest into that and merge that with your scientific finding? It provides historic context, practical experience, and I think that is much more it provides much more sustainable solutions to go forward. And I also want to say this is it's a learning experience for me. It's a place that I'm moving towards. As you would see in my presentation, I'm not saying that I have the answers, but this is the direction that I think most of us need to start thinking as we're trying to work with communities. And one of the reasons why that community engagement has become really integral in my work with my students as I do my research. So I'm going to present about two projects in Arizona and about two in Tanzania, just to share the significance of some of the work that we're doing, or hopefully will be significant when we get to the intervention piece and not just collecting data. And I will talk a little bit about how I see my research, moving forward and the contribution later on to communities. So this particular project, Helicobacter pylori, arsenic and health outcomes along the border, the title of the project, we had seen specific interest to look at Helicobacter exposure in communities in Arizona, because Arizona and the border region is predominantly Hispanic communities, and Helicobacter pylori is associated as a risk factor for gastric cancer and other gastric conditions. One of the things, or at least one of the research gaps when it comes to H. pylori and infection, for instance, we know about 99% of most of us who have lived, for instance, in developing countries or in the African continent may have been exposed to H. pylori, but not everybody manifests into a disease. Another key factor is that transmission is poorly understood, and even in places where people may be at risk, it's also poorly understood what are the sources. We do know what the sources may be, places where you have poor sanitation, access to water, in which the water communities, we have colonias, colonia meaning communities that are not integrated into proper distribution water system and sanitary conditions. And we have transboundary water spillovers, but specific when we look, or at least our understanding in general, we have higher rates of gastric cancer in Hispanic communities compared to non-Hispanic communities. We had other studies that were done, so we do know that drinking water, because of the different sources, right? They don't always get water from drinking, from distribution water system. Potential could be one of those sources of exposures. So this was one of the motivations behind why we wanted to look at exposure of H. pylori, what are the sources and potential exposure, but also looking at communities' knowledge on what water issues in general. So gastric cancer presents significant health disparities in Hispanic communities, where we see higher, disproportionately higher compared to the Hispanic white population. The risk is twice compared to other population. And also the other aspect of this, because when we go out to collect water sample, I tend to work with other partners who bring in different value to the project to make it more comprehensive in terms of, I do a lot of quantitative, we need a qualitative studies. And once you are able to collect water samples, some of you may appreciate going out to communities and collecting these samples alone is very, very expensive. So even though my focus tends to be on the microbiology, I usually do micro, and I always do chemical because I already have the water samples. One of the issues too along the border is a high prevalence of arsenic, because geologically Arizona has high presence of arsenic. So for this particular project, we wanted to look at prevalence of H. pylori, but we also took measurements from drinking water sources for arsenic as well, because of other health conditions associated with arsenic. So our aim was to improve our understanding of potential exposure to H. pylori and metals from drinking water sources, and improve our understanding on communities' knowledge and their perception on water quality. This is the region where we collected samples. So here I'm showing Nogales and Naco. These are two sister cities. So you would have Naco, Arizona, and Naco, Mexico, right along the border. And there are actually about 4 sister cities. But we focused on the 2 sister cities. But for this beginning of this particular project, we started with the work we did in Mexico. So all these samples that I'm going to share here and walk for this particular talk, it's on the Mexico side. This summer we started collecting on the US side, but we haven't finished analyzing the samples. So in total, we were able to collect 60 water samples and we were able to look at different water sources. So one thing I wanted to highlight here, which sometimes I think is not always evident for people outside the United States, but most of these homes, so I'm going to go back this way. So this is the Mexico side, and I will share their water sources being tap water, meaning pulled in from distribution water system, PFAS, and wells. But those conditions are similar in the US side as well, even though I'm not presenting that here. So the word, when you see PFAS, is those delivery trucks that bring in water. So we analyzed microbial samples specifically for total coliforms and E. coli. And E. coli is a specific fecal indicator, and this is a standard method. They call it one method. It's a standard method that's approved by EPA. And then to look at potential presence of H. pylori, we did PCR. So in addition to that, we also collected surveys. So we did health and environmental surveys. Environmental surveys focused on the sanitary conditions of the environment. And the health survey captured specific information for health. And for the purposes of time, I'm not able to share all the questions on health survey and environmental survey, but part of this study has already been published. So if you're interested, you can let me know. So for microbial water quality, we were able to see that 10% of public water systems, meaning that those are waters that have been treated, 10% of them tested positive for cholelert and for total coliform and E. coli, and 82% of the people ones, those are the informal delivery methods, tested positive for total coliform and E. coli. And H. pylori, this was a very small sample size, as you can appreciate. H. pylori, we were able to confirm in one sample, which was a public actually water sample. But in 8 different samples, we were able to identify other virulent factors that are related to H. pylori. And we couldn't say specifically whether those virulent factors are from H. pylori because those virulent factors are also shared with other pathogens. And this is one thing that we're trying to improve on our methodology for this second part of the project. So we looked the PCR method we had to do, it was a multiplex, but we're able to do on just identify H. pylori and the virulent factor. But you also have to make decisions which H. pylori strain and which virulent factor you're going to target because there are over 200 strains of H. pylori and which virulent factor. So it was basically first looking and making the decision on we will focus maybe on 2 or 3 strains and maybe 7 virulent factor and see what's there before we can refine further for the next step of this project. And this is just the results showing. So when we look specifically the positive samples for E. coli and coliform, at the top you will see the legend in a sense, the interest here, so you can see which results came from PIPA and which ones came from the public water system. So when we look at Nogales specifically, from PIPA, higher percentage of those that are informally delivered, as we would expect, right, that are positive for both coliform and E. coli, but also those from public, which we wouldn't expect because water should have been treated and have enough chlorine until delivery, but we're still seeing positive results for coliforms and E. coli. So the most, I guess, aha moment here, the PFAS was expected, but the public municipal water, we were not expecting to see positive for E. coli at least, maybe coliform, but not necessarily E. coli, because coliform, they're sometimes present in the environment. It doesn't always mean that it's fecally contaminated as opposed to E. coli specifically fecally contaminated. And this is at the bottom, that is This one is still in review. I'll share the ones for chemicals. That's a paper that has been published. So in addition, when we looked at the data from the survey, we do see that there was lack of knowledge about the risks associated with water contamination or H. pylori infection and the risk of gastric cancer. Some of the community members attributed some of the gastric issues actually is just being spicy food. The surveys also identified prevalence of GI illnesses in the community and the lack of knowledge that may be associated with health risks. So while this was a smaller sample size for the other side of the community, but it gave us enough data to be able to set up the next step of the project. Here I'm sharing the results for chemicals. So for chemicals, if you are interested in arsenic, when we run the results, we get maybe 15 different metals. And the same if we're interested, for instance, in lead, it's another suite. So I just selected a few here of importance, but we ran results for maybe about 20 different metals or so for these water samples. Here we have the maximum contaminant level G, MCLG, which is really the goal. This is the maximum contaminant level goal, which you would see it's supposed to be, for instance, for antimony, you have for arsenic, for barium. So these are the numbers. And then into the brackets, it's our findings and percentage. So I hope that's clear. At the far end, it gives our geometric mean and also median. So to give you an idea of the range, the maximum, the mean, and also which ones we found are positive. The one good thing is, and we also have the Mexico official standards. So these are the ones are US EPA standards, and we also included the Mexican standard. Well, for the MCL, that's what's regulated, the maximum contaminant level. The good thing is all of them were below the MCL, except for the antimony. But when we look at the maximum contaminant level goal, which you should really have zero arsenic and zero lead, as we all know that there aren't really safe levels for lead, even though there is a threshold. And these are the values. So for MCLG, arsenic and lead were above the MCLG, but antimony was above for MCLG and MCL. And this is just about the summary, what I just talked about. But in the study, 19 metalloids were detected. So we detected all of them, even though all of them were below the MCL, but they were all detected in those water samples, including arsenic and lead. When we look at specifically the water quality perception for the community, one thing to note, the population was very diverse. However, there is extreme poverty level in those communities. Most families, about 20, belong to large families, and only about 5 had attained higher school education. And such water quality, when you look at water quality perception for different people who use the public water system versus PIPA, they all ranked the one thing, I'm going to summarize this, the one thing that they all had agreed on is everybody's saying, regardless, everybody's saying their water did not taste good, it was murky, even though the results for microbial, it shows that, there were a high level of contamination. For chemicals, even though we detected them, they were below the levels. But one thing that they all based, that they agreed on too, there was an agreement and they were based their decisions, it's because even though they had water, whether it was from public tap or from PIPAs, they all had sporadic water availability. They did not always have water availability. There were no significant differences between constant water availability between those with PIPA and public users. So they all had that. We had PIPA of 0.6. 62% of all participants reported that they had sufficient water within the past month. That was the question that was asked. And the survey resulted indicated just the general lack of participation in environmental governance, even though they had concerns and things that were of issues of concern to them, including garbage disposal, flooding, clogged drainage, smelly streets, and so forth. this is something that we see to be different in some of the communities. For instance, in Arizona that we work with, people tend to be more involved, or at least wanting to participate in that environmental governance. And I will also share some results for Tanzania as well. We kind of ask similar questions. But in general, for this community, we saw there wasn't really, there was no not wanting or the attribute of that, wanting to participate in any of this governmental environmental governance. And that itself is an issue, and you can unpack that in different ways. So overall, the surveys highlighted no significant association when we look at just the social demographic factors and involvement in environmental conscious behavior, but it may well be also because this community is very, very similar when we look at, income, when we look at education and other issues that's why we may not have seen any significance. One thing, regardless whether you got water on tap or pipa, they all relied on water bottles. Nobody drank their tap water. So everybody drank tap bottled water, which also tends to be expensive, especially for these types of communities. So this is one of the studies that we've done in the community. The way we were able to do all this work is through community health workers on the other side. So we provide training and have meetings and have them do all the water collection after training. And then we will just process in the lab and then go back and, of course, report back to the community. The next one that I wanted to also be able to share, this was one of the larger work that we have done, much broader, looking at different water quality issues. It was a much larger team. Other folks, as usual, I'm always interested in microbial water quality. There were teams that were interested specifically for metals, and others were interested in PFAS, and others were interested on how communities learn best. So this project was funded. I was a co-PI, was funded by NSF for 5 years. And we actually used the rainwater platform to look at advancing informal environmental health STEM learning, co-created citizen science rainwater harvesting in underserved communities. And simply put, is we use the rainwater harvesting platform because now because of all the movement and all the support that is going into collecting rainwater to supplement water uses, in this particular area, Arizona being in the semi-arid, it's a desert, people have more concern on water issues, but now everybody's collecting water. And I say everybody, it's a larger population that are now collecting rainwater, they're harvesting rainwater, but there are a lot of concerns on water safety, and there is limited literature. So we were able actually to provide a much more comprehensive set of data to inform the communities and local leaders as well. So a lot of efforts to conserve water, which uses to supplement household uses. Some people also use that water for gardening and produce and so forth. And there were concerns of water quality for harvested rainwater, particularly microbial metals and PFAS. And the PFAS part especially comes from the types of metals, right? We live in a lot of materials, and you think about all the water that washes on my rooftop, and then I have these big cisterns that I'm collecting and keeping the water. How safe is my water? So for this particular one, the aim was to use rainwater harvesting platform to train community health workers and large community on environmental health issues. And we wanted to be able to assess microbial water quality of harvested rainwater infrastructure and also build upon the limited evidence on safety of harvested rainwater. And at that time, we're hoping with the information we had, we'll be able to provide some guidance if we found that there were any issues. So we provided training to all communities that were interested. Not everybody participated in actually providing water samples, but we targeted 4 different Arizona communities. So we went rural and mix of rural communities and urban. And all these communities members who were participants, they collected their harvested rainwater sample for 3 years. And we made it by season. So we had winter, summer, but also summer capturing the monsoon season. We had monsoon in Arizona. For microbial, we analyzed again for E. coli and coliform, but we also taking you back, even though this is not part of the bigger discussion, but there was also the aspect of having how do communities learn best, but communities also wanting to do some type of science with us. So we came up with a way where we use the SRB stands for sulfate reducing bacteria. It's another test that you can do outside in addition of to look at E. coli or total coliform. E. coli and total coliform, these are standard methods for water quality. Sulfur reducing bacteria, there is literature that it may be a good test to look at water contamination, and the literature and the idea at that time, way back when maybe 10, 15 years ago, was to use that in developing countries because you don't need a lab, it's cheaper. So we use that SRB as a way where the community members themselves, they can do the experiment, but they collected the water sample and gave them to us to do for E. coli and coliform. So this study design actually allowed us for the validation of potentially low-cost and home alternative methodology for them to test their watering. They were interested in, but also there was that aspect of the learning that other partners were also doing. And this particular study, actually with this one, we published efficacy of hydrogen sulfide test for testing microbial contamination. And these are the communities that we work with. So I have marked letters in red. So that's Dewey Humboldt up north, Gila, Miami, Hayden, Wickman, and then Tucson. So we had 3 rural communities, and Tucson being urban or metropolitan. And those rural communities are heavily mining communities or mining legacy communities. So there were also other interests of, if I'm a mining community, on windy days, does it capture any of the contaminants and gets deposited in my cisterns? And that's why there was that heavy concern as well for metals and other chemicals. I'm showing here just the results for total coliform and E. coli and SRB. Again, we did publish a lot of this. If anybody's interested on the chemical part, they can let me know. So looking specifically at the total coliform and E. coli results for the harvested rainwater, we do see for all communities having higher levels of total coliform, but again, being these are environmental samples, that wouldn't really be a concern in itself, and they're not meant for drinking, right? The total coliform and E. coli standards for drinking, but those are the only standards we have. So I just wanted to highlight that. But specifically in Hayden, Wickman, we also found a higher, much more elevated level of total of E. coli, which is a fecal indicator, much higher compared to the other ones, even though we found some in Tucson and very, very maybe 1 or 2 in these other communities that doesn't really come up on the scale there. So we did find positive total coliform, which would expect for environmental samples, but fecal indicators, that raises other questions, and it may well be that you have animals in the surroundings and so forth. And we did collect the actual survey to kind of capture what are other sources of contaminants that may potentially be present to have this type of contaminants, especially when it comes to fecal E. coli. So in total, we were able to collect 226 samples, and we tested both methodology, the SRB and the coliform. So we did see there was a correlation between coliform and SRB. So in other words, if you were just interested to see the safety of your water from just coliform perspective, right? SRB would be a good way to test your water. There was correlation. But given that these are environmental water samples, it may not give you any more information that you wouldn't, know. The concern is always with E. coli. There was no correlation between SRB and E. coli. And we highlighted this in the paper. There are other studies in other communities. Actually, they do find correlation in other communities, in other geographic areas that they do not. So we think it always depends on maybe the geographic location and how much pollutants are already in the environment. It's inconclusive, in other words. So this work indicates potential value for SRB testing for harvested rainwater. It costs lab access and fecal contamination of concern. results also were shared with Tucson Water. So Tucson Water, who provides water for most of us in Tucson, for instance, they have rebate programs where they would pay up to $2,000 to a household to install cistern infrastructure and buy a cistern. So they also had interest in having some type of data on potential safety of harvested rainwater from microbial and chemical perspective. The other question that was also of interest from community members were if I use my harvested rainwater for produce, is it safe? So there was this answer. The next question where we had community members also submit water samples that they usually use for irrigation for their produce. And we set up the study where we also looked at the soil that just gets irrigated with tap water versus the ones that are being irrigated with harvested rainwater. And just to sum this up very quickly, and of course, they also provided a survey to tell us what they use, how they amend their soils and so forth. But to sum that up, we did not see any association, meaning that using harvested rainwater did not make any difference to your soil quality compared to if you were using tap water. The only differences we saw, in terms of your water quality actually was really associated whether there was proximity, animal presence in the environment, your cistern treatment, your cistern edge, and so forth. Not so much just the use of rainwater harvesting quality itself. But one thing we did note, coliform and E. coli concentration in all our samples actually were much higher in the monsoon season than before, and that may well be, of course, monsoon, the first rainy season just brings everything, but that type of information also allowed us to be able to tell the community members, have the first flush for your harvested rainwater. Maybe you do not capture the first monsoon, right? To keep your cistern clean and to keep your water quality at much better quality. So for this particular project, we really successfully engaged with a diverse community. We were able to provide information that was very useful to even the local government of the city water provider. And we generated evidence to support local solutions. And we actually published, the link is at the bottom, where you have all the data, all the microbial data, all the chemicals, the metals, and all the PFAS. So PFAS took us a very long time to be able to get PFAS results. And those are my colleagues who were really focused on the PFAS. But eventually we were able to get there, and all the work actually has been published. And prior to that, there was some limited work actually in Australia and actually some in South Africa looking at water quality. But now we have a much broader, much larger data set for Arizona as well. So this is just some of the work.
I wonder if you can wrap up in about 8 minutes.
Yes, I can. Yes. So we can. Okay. I was going to stop at 45.
That's not working.
Oh, so thanks for mentioning that. So some of the work that we're continuing in these communities, we're looking more now using the household water experience tool, which is much more advanced tool that is being used now. This is the second phase to look at household water insecurity experiences and capture resilience, water quality issues, affordability, motions, and so forth. So this is just what we've been working on now with some of these communities. I'll share briefly just the next one. I'll take just very few minutes. This particular one is my interest in WASH, and we worked with communities in Tanzania, and particularly this community that we work with. I'm going to show here a picture. They had very high rates of malnutrition, diarrhea diseases, and really lack of access to water sanitation. And we were able to work with the communities and local, like ward leaders, to be able to do a cross-sectional study to look at different aspects. So let me step back. So one of the gaps that we have in WASH, water sanitation hygiene, is we really have a problem to tie the evidence to say WASH intervention itself improve health outcome. So for this study, what we're trying to do is really to identify whether the presence of WASH services alone is associated with fewer children under 5 experiencing different symptoms of diarrhea to build evidence for WASH. We collected data for 452 households. We looked at different variables, including food security, education of the mother, vaccination, and household income. And I'm gonna go straight to the findings. What we were able to discover is WASH itself by itself does not actually have a significant impact on the area, but education, but other determinants of health, like education of the mother with at least one WASH service, and also the odds of lower food insecurity in the household were 2.4 times greater for a child to be much healthier than if there was higher food insecurity. So the two things here was the education that was significant with at least one WASH service, and also food insecurity, and not WASH itself, just by itself. The remaining factors, vaccination status, income, were not as significant. So the messaging here is really combining WASH interventions with other social determinants of health to improve health outcomes. And I will end here so we have enough time for questions. And we did publish this as well, maybe just 2 or 3 months ago. I will stop here and I'll take questions. And are you facilitating questions from online?
I will try and check my phone.
Okay.
But thank you very much for that, Aminata. I mean, it's so much work that's being done. And I think you've given us kind of little bits and pieces to hope stimulate quite a few questions. So I'll open it up to questions first before I ask anything. Are there any questions in the room? Yeah,
Yeah, I've got a couple of related questions. I'd like to know, like, for the first study, the sampling, did you choose from different households, like low income and high income in your first study? And water source, the public water source, what was the public water source and why people kind of reluctant to drink that water?
Yeah, for the second, is it base study? The first one. I have to remember which, this one, right? Yes,
yeah.
The Helicobacter one.
Yeah. Great.
So the first study was much more random selection. So we didn't look at just the high and differentiate between the high and the low, but overall the community that we collected water samples from, they were much lower income communities. Traditionally, like these communities that right at the border, they tend to do jobs like assembly, agricultural, and they tend also to live in an environment where, you know, the low income people would live. If you have a little bit high income, you go to places where water is better, your water is piped in, you know. But these tend to be more like, we call them colonias. There may be a different name that we can use here. But colonias tend to be homes or at least communities that they are not integrated into the proper city. So that answers one question.
Yeah.
And the next one.
And so what was the public source for these communities?
Yeah, so the public sources was what we would call water distribution systems, right? For the tap, the ones that
So is it a dam, like a storage dam, you know?
would be a storage, but there are also, depending how, because we have no way of verifying that. So for instance, what we learned in Arizona, on the Arizona side, a community would have a tap water and they'll tell you, I get water from my tap water. But actually it's a larger community well from somebody who provides water to that community. It's not your city community distribution water system. Yeah. So we think even the way we would ask HAP, is it coming from distributor, was system treated, and they would say yes. But I think even the way we understand what is considered tap water is different. These are all things that we're learning also as we go. So in Arizona, we've made adjustments, even how we follow up with that question. As opposed to in Mexico, we had not realized that we need follow up to actually have a better definition of what would be considered tap water.
So that also maybe provide insight to my last question about why people were reluctant to drink the public water.
Yes, and as we can see with the microbial data, actually, the waters are highly contaminated, and you can see. And if you have intermittent water supply, usually you would have periods where the water does come. So few of them did say water will come out brown and, from tap or the ones that the vendors are bringing in. But when you have places of intermittent water supply, those tend to be issues of, water that comes out colored brown or it smells because of the period that is gone without the pipes, having water.
Thank you. I forgot to say, a very interesting presentation.
Thank you. I appreciate that. Yes.
Yeah, many thanks, Aminata. Can you tell us a bit more about Indigenous knowledge and how that was used for culturally relevant interventions?
Yeah.
Okay.
So for Arizona, just giving perspective, we do have indigenous knowledge where it's our Native Americans, right? Which is separate from when we go to border communities. Actually, you have to use even community health workers for you to be welcome in the community. We can't just go in and collect water sample. So for my research, I'm particularly referring to that. Or like when I go to communities in Tanzania, like the knowledge that they have, separate from the indigenous, the way we use it. So for instance, for the local context and the information that we're able to collect in, for instance, if I talk about Mexico or Arizona, issues related to intermittent water supply, I'll use the examples, where they get their water sample, how often maybe they may not receive water, or gaining information and collectively, for instance, we see most of the issues they talk about, well, I have stomach issues, but everybody tells you it's because of all the spicy food we eat. But then if you ask the questions, you would ask people have been diagnosed with gastric cancer and other. So that to me is the local knowledge, right, of these communities, how they understand some of these health issues, which can inform us on how we can go back and provide intervention tailored. So if we were to tailor trainings, what examples can we use that are more relevant to that?
Right.
So things, those type of things, nuances that we have to pull. And in Tanzania, I didn't present some of the work that we're doing, looking at the community resilience for at-risk communities with cholera and diarrhea. One thing which was surprising to me is, when we ask questions about their knowledge and awareness of climate change and waterborne diseases, those that are highly educated, right, they understand that. We would expect that. But then the less educated ones, the ones who are on the poorest of the, bracket of the poorest, they have more concerns about who is going to address and how these issues are going to address compared to those who are at the highest, and that is really a local thing because I don't capture that in all the communities that I have. So if we're to go back and think about tailoring interventions related to climate change and water safety and water security, there is some knowledge that has come from the community that we can utilize, right? As almost like a hook, like it's a place where we can start discussing it and not just going on in and just imposing, this is what should be done. But it's really drawing that knowledge and then go back again. Yeah. I hope that answers the question again.
Thank you. Are there other questions?
Just a comment also, that's after you.
No, go ahead.
No, I was just reading a recent Daily Maverick story about a change-made entrepreneur in the Eastern Cape who was really concerned growing up about the quality of water in schools. And so he developed a low-cost water filtration device. And I just wondered, whether schools were part of the intervention, because, in the Eastern Cape and many parts of our country, that is crucial. Kids are, not getting enough water at school because the quality is so poor.
But that's, I think, across all African countries, which I reflect. I went to school in Tanzania that had this discussion. I have kids now. I have bottled water, they drink water all day. And I asked my mom, I said, I was privileged some time of my life. I was at an international school that was different in a different country. We moved to Tanzania, I went to a local school. And while there were things that even at that time, because you've had different exposure, you can see. But even now, as I grow up, I've grown back, I've grown up with my own children living in a different, I reflect. But because those are reality of how they live every day, that's never an issue that's discussed. That kids go all day without drinking water. I never had anybody discuss that. Yeah, it's a norm, right? Yeah.
A lovely story, I'll share.
It is. Thank you. Please do. I've read other stories, what's going on with water pollution. Thank you.
Are there other questions in the room? And how about online? I don't know if online can hear me. Maybe you can ask from there. If there are any questions?
Are there any questions from online audience? Maybe I can skip this and
I'm
see.
not seeing any at the moment.
We're
Yeah.
able to see it.
Is there a hand up?
No.
Oh, there you go. No, it's not. I see, it looks like the camera was on a little bit late. I'll show you. It's a little nice. No,
I see one. Wait, I see a conversation. Okay, just okay.
Yeah.
Thank you, Natasha, if you can hear us.
So
Somebody is typing.
I was reflecting, that I was reflecting, maybe go, no question. Thoughtful presentation, thank you for that. Just going back to kind of the topic of the presentation, and I was thinking, all the areas that you've been researching in, all the different communities, what would be some of the kind of key climate resilience issues, or not issues, but more messages or lessons learned, that like 2 or 3 that you could say?
Yeah, and I have often reflected on that after we collect all this data, right? What would be the resilience things that I observe that the community is actually already doing, right? Because to some degree, communities are already doing something, and then what can I bring to the table given all the information? So in specifically, when we look at the border region or in Arizona, maybe in general, that's an easy one when I talk about the resilience. The harvesting rainwater, where all these communities are already doing, it's part of the building community resilience to water security issues. But it takes a lot of resources to be able to build that type of infrastructure. And the way that infrastructure has been built, it's by providing a lot of rebates and a lot of money. When I look at climate resilience specifically for water for like Tanzania, people do rainwater harvesting, but they don't see it as addressing, and I don't know where the disconnect is. I think there haven't been enough messaging as well, right? And connecting the dots. They are doing it to some degree, but it's a much more, I'm trying to find the right words. It's, to me, because it's something that the family can do, actually can do it much cheaper, different from the way we're doing it in the US. It's that would be one of my most messaging, right? To when we think about communities that do not have water, or they have intermittent water supply, there's a lot of rain. There are some times where they have drought, but there's a lot of rain. Like putting a lot of messaging and encouraging people to actually go back and adapt. And these are things that traditionally have been done in the past, right? To collect rainwater as part of issues that addresses their insufficient water supply. But now as we think about climate change, it's actually an adaptive measure, but it's very low cost for those communities to be able to do that. But I think there still need to be some support from the government. So that's one when I think about just the access and increasing the water supply. When it comes to health specifically, with the issues that I see, I tend to focus more on the microbial but even chemicals, but mostly the microbial. What do communities need to do to be much more resilient when it comes to health? And I know in public health, we tend to almost overuse education, but I still, even with all the educational programs that we have actually done in public health for a very long time, I still see that there is a need to first start there to really provide more information. Some of the surveys we did for the communities in Tanzania, everybody gets messaging from now these days social media, and there's almost no, I think only 3 or 5 people say they get messaging from the Ministry of Health. But if messaging comes from key it is developed at least from key officials, right, with the proper messaging related to climate change. And then it could be disseminated, of course, in social media. But there is really, I don't think we're even at the point where we can discuss, when I think about particularly the communities that I work with, what they can do to address climate change or resilient more at the community level. I don't have good examples other than the rainwater harvesting, which I see could be done both one place, very successful in African countries. My example being Tanzania could easily be done, but nothing has really been done to that scale. And then when it comes to the health, particular health aspect, the cases for diarrhea diseases, cholera is happening frequently. So I almost feel like we've gone backwards. We're collecting a lot of information, but we haven't been able to really integrate that to help the communities yet. I don't see the evidence of that
Yeah.
yet. Yeah.
Thank you for that. Thanks for ending a very, very informative presentation.
Thank
A
you.
very good presentation on that point, because I think a general response we hear time and time again is, oh, we need awareness raising, whatever the issue is that any of us are dealing with in our research. You know, the communities don't know, people don't know, the public don't know. But the fact of the matter is that those people who are saying we need awareness raising often don't understand how to actually communicate information and to get a buy-in from the community in order to understand the information, but also whether they can actually implement it. Is it actually realistic?
Yeah, exactly.
Yeah. So thank you very much. And I
Thank
hope people will look at the papers, the many papers that you published. And we look forward to hosting you until November.
Thank you.
So thank you very much.
Thank you very much.
And thanks to those of you who were online. Great.
Yeah.
Just realized.